Good morning and welcome. Thank you for being here. As you know, this is all about the Every Woman Counts budget reductions. According to the California Cancer Registry, among women, breast cancer is the most commonly diagnosed cancer across the sexes. It is also the most common cause of cancer death. The registry estimates that in 2010, there will be more than 22,000 California women diagnosed with primary breast cancer, and 4,200 women, mothers, wives, sisters, and daughters, will die from the disease. Currently, the California Department of Public Health, let me say it again because that's what matters here, the California Department of Public Health reimburses providers for breast cancer screening for low-income women 40 years of age and older under the Every Woman Counts program. Last year, the coalition that is standing here with me worked diligently to secure passage of Assembly Bill 395, which allowed for digital mammography technology to be used when screening Every Woman Count participants. AB 395 was a crucial step towards ensuring that California's low-income women are receiving the coverage they need to diagnose and treat breast cancer at its earliest stage. Consequently, you can imagine my surprise and horror when I received word that earlier this month, the California Department of Public Health issued a new set of guidelines to counties concerning the Every Woman Counts program. According to the memo, and a copy is included in your press package, effective in just a few days, January 1, the department will cease enrolling women under the age of 50 and will freeze enrollments for women age 50 and older until July 1 of 2010. By all accounts, this directive was issued with absurdly short notice and no public oversight. To make matters worse, since the memo was released, department spokespeople have issued conflicting and confusing statements about the condition of Proposition 99's Breast and Cervical Cancer Fund and its ability to support the population it serves. Let it be said here, not only has the California Department of Public Health just issued a death sentence to low-income women in California under the age of 50, they've created a two-tiered system for response to breast cancer screening in our state. State law requires that all private carriers provide mammography screening for women age 40 and older. The legislature specifically deemed early cancer detection to be a priority life-saving measure for women in California. The guidelines that have been issued effectively tell women across the state that because of their income, the fact that they rely on federal and state-funded programs, that under the Every Woman Counts program, they don't. Maybe a name change is in order. How about the Almost Every Woman Counts program? On behalf of the legislature and all of those standing here today, I say shame on the Department of Public Health. Shame on them for issuing this directive in the dark of night. And shame on them for not being able to even explain in English the reason for these changes. My office will immediately begin working to put a stakeholder meeting together. The department and the administration should view this meeting as an opportunity to clear up these confusions, discuss the future management of the Every Woman Counts program, and reestablish their priority to saving lives in California.